Hello, lovely. How are you? Good. How can I help you? All right. And how long have you been experiencing that for? All right. If you can describe the pain for me. It's like a pinching, shooting, burning sensation. Alright. Is it very painful and sharp? Has any pain relief helped at all? Not really. Used any ice or heat? Any relief? Okay. Right, so pop your name down. So we've got painful, sharp, stabbing, tingling, numb, pinching sensation. So you feel quite weak, did you say? In any particular place? Right, and whereabouts do you experience the pain? So, are we talking just above the buttocks, lower back? And it go down through your bum, right the way down your leg to your ankle or foot? Is it in a particular place? Okay. Which side? Is it both or the left? Okay. So, do you get any sensation in your toes at all? Just a little bit of tingling. Would you say the pain feels like an electric shock? Alright. Have you experienced anything like this before? Ever had a trapped nerve? Okay. Alright. Are you doing anything in particular when this triggered off? So you were just doing some housework and it started. Any time of day that it's worse? And what about if you're coughing, sneezing? Okay, what about moving? Alright. That's fine. Have you ever heard of sciatica? Right, so if you just look at my chart, so the nervous system is very important and very large and complex. Now, if you just look over here runs the sciatic nerve. Okay, and some people do have problems with it. What happens is it becomes irritated, inflamed and compressed, and it can kind of get stuck, if you like. Yeah, and that causes extreme pain, which exactly like you're describing, actually. Yeah, that's right. That's what I'm thinking, but I will have a little feel around. Okay, so if I could just get you to pop on the scales for me, I would just like to check your weight. Just over there. Thank you. Okay, alright, that's fine, thank you. Good. Healthy weight. Sometimes if we are overweight, that can cause it. If we're not very fit, or if we're too fit, just happens on its own. Okay. But I'm going to have a good look for you and a feel. Right, if I can get you to do just a few things for me. If you could just stand up for me. I'm going to get you to do a series of things. If you can just let me know if you're experiencing any of the pain or anything like that, and whereabouts. Alright, so if you can just stand normal for me. And how would you say your posture is? Is this how you would normally stand? Okay. Good. If you could just bend your knees for me. Back up. Back down. And back up. Good. Could you rotate your hips in a circle? And the other way. Good. If you could just sway your hips for me. Yeah? Alright. And stop. If you could just bend and try to touch your toes, or just as far as you can go. Okay. That's fine. Okay, so if you could try to bend a bit back for me, if you know, just lean back a little bit. Alright, don't worry. Thank you. Alright. If you could just march on the spot for me. Nothing too extensive. Good, thank you. If you could just take it up to a little bit of a jog. Brilliant. Okay, and stop. You can take a seat for me. Yeah. And was that every time, or right? Anywhere in particular? Yeah, I thought you might say that. It did seem a little bit uncomfortable. Okay. Would you say you're quite an active person, or and what do you do for a job? Are you sitting down a lot, or? Okay. Wonderful. Right, if you could just lift your foot like so. Other side. Side to side. And the other one. Anything there? Okay. if I could get you to just rotate your foot for me. And the other one. Wonderful, thank you. Now, if you can get your hand and go like so. And the other side. Good. Let's go like this for me. And the other one. Okay. If I could get you to just reach up, down with one hand. Other one. And out. Now, can you do it at the same time? So, hands up for me. Out. And just down a little bit. Yeah. Yeah. Okay. Do you ever get any back pain usually, or burning sensations, tingling, any pain in your shoulders or spine, lower back? What about when you're lying down? Okay. Right. Okay. Have you been taking anything at all for it? Yeah, you did mention that. Yeah. Okay. Okay, that's fine. If you could get your head like so, and like so. Good. And if you try to do it in a nice big circle both ways. Great. That's fine. I can just get you to stretch your arms out, up, and then behind your back for me. Yeah. Okay, thank you. Okay, you can relax. All right. So, let's have a look what's going on. Whilst you're seated, I'm going to just have a little feel around your hips and just round your lower back. It's quite sensitive. Alright. Good. Just feel that side. And there too, or not. Okay. That's fine. And just feel let it that help a little bit? Right, okay. I'm going to pop your foot there for me. I think around the ankle. Okay, pop your down, check the other side before that. Okay. Anything there? Right. I'll just like a little bit. Okay. You can relax. So it is definitely on the left side. All right. Yep. So if I could get you to now stand for me. Okay. Right. I'm just going to hold your hips. Can you just sway? Good. And rotate your hips. Good. And relax. Just going to go down your pelvis a little bit. Any pain at all? Okay. Okay, that's fine. Just going to feel down your thighs. Okay, that's fine. I'm just going to concentrate on the left now. So, any sensation? Okay. Okay. What about that? Okay, that's fine. I'm just going to go further down to your calf. And what about that? Would you say it's more at the front, or the back, sides, or everywhere? Okay. I'm just going to feel just above your hips, okay? I'm now going to press. How's that? Just go around. I'm just going to press like that. Yeah. Oh, I'm sorry. Okay, and onto the buttocks, if that's okay. And press. Yeah. Oh, I'm so sorry. And there. Okay. And what about there? Yeah. And your thigh. Okay. Right. that's definitely sciatica. All right. Yeah. Okay. All right, you may sit down. It's not very nice, is it? Yeah, there's definitely a little bit of stress going on there with the sciatic nerve. All right, but we can help relieve it, so don't worry. Yeah, I'll give you some advice and things, and we'll go from there. Okay, good. But I would like to check your reflexes, okay? When I was doing everything, could you feel everything all right? So there was no loss of sensation or anything? Good. Okay, if I could have your elbows. Good. Your knees. Excellent reaction there. That's really good. So, just jot that down. And then I'll have to write all these notes up later. So, as you do experience problems with your spine as well and your shoulders, I think it might be ideal if you possibly go and see a rheumatologist. Yeah. I want to miss out the orthopaedics and go straight to the rheumatologist. Yeah, I mean, if you've got a lot of chronic pain everywhere, and right, so you get a lot of aches and pains in your legs anyway. Right. Okay, if you could just tell me the things that you experience. Anything, however big or small you may think it is, it might be relevant. Yeah. And how long's all this been going on for? It's quite a while. Has it been getting worse, do you think? Okay. Migraines, we could do sorting those out, can't we? That sounds very extreme. What about your neck? Yeah. Okay. Alright, I think I'm definitely going to refer you to a rheumatologist. Right, so let me just tell you a few things. So, if you can carry on as normal, try to exercise, do some stretches, very important. Try not to lie too flat, maybe pop something under your knees to help support you. Yeah, and if you're in a bit of pain, try to raise your legs slightly. Okay, so lie on your back and bring your legs up, maybe do some rocking. Alright, anti-inflammatories, painkillers. If paracetamol's not enough, I'd suggest some cocodamol. And if the over-the-counter aren't strong enough, then I would suggest that I prescribe you something a bit stronger. Alright, yes, heat packs, please don't use any ice or anything like that. Yeah, there's things we can do. I mean, there's physio, CBT to help mind over matter, but a lot of people don't have a lot of joy with that. There's injections that we can seal off the nerves, and there's surgery and nerve blockers and all sorts of different things like that we can do, but that is way down the line. We hopefully don't need to come to that. We can solve it as we are now. Yeah, but I think it would be good for me to refer you on, and they can have a look at the sciatic nerve and things like that as well, and all your joints, bones, your muscles and things like that. I think it would be really useful to have a look at that spine. Yeah, I mean, you can get like spinal issues and things like that, and if there's been injury and stuff. I think you'd benefit from regular massages, but not just regular massages. I think you would need to see a sports therapist and have a proper sports massage. It's a lot deeper and they can, you know, stretch muscles and things like that. I'm not sure because obviously I'm not trained in that, but they are very good and they will probably help relieve the nerve and things like that. And then they could probably find out all sorts of other things that are going on and help relieve stress and tension and things like that. Definitely recommend. Yeah. It's a good one actually downtown. Yeah, I'd probably recommend going there. Okay, that's a good starting point. And just tell them that you've seen me and I've said it's fine, and you know that I've referred you on to a specialist and things like that. All right, you're very welcome. Right, what I'm going to do for you, I'm just going to give you a little bit of a massage just to help relieve it today. Okay, and then you are free to go. I'm not going to do too much, so don't worry. Okay, if you just relax for me. Okay, I'll try to be as gentle as possible, but the more I work on it, the more relief that you'll have. Okay, my lovely. Perfect. Okay. Start off nice and gentle. And just going all over the lower back, and then I will concentrate on the left side. Okay. I know, I'm so sorry. You're doing well though. Is it okay if I go on to the buttocks? Thank you. Okay, there we go. I'm just going to be working on this one. it, just breathe through it. Yeah, I'm trained in massage as well. Yeah, just not sports massage. You do really, really well. Okay, I'm just going to go down onto your thigh a little bit and then I'm going to round it up. Okay, just go back up and just finish the massage. There we go. Okay, just remove that. Let me just get you some blue roll. Okay, you can just use this to remove any excess oil. Okay, there you go. Okay, so how was that for you? Good. You'll be a little bit sore, alright? Yeah, it's perfectly normal. But you will find that you've got a little bit of relief. Okay. Don't worry, I will get on with the referral to the rheumatologist. Okay. Yeah, and then I would like to see you in about a couple of weeks. Alright. I just do the things that I've told you to do, and then we'll go from there. And hopefully you would have heard from the rheumatologist by then. Okay, my lovely. You are very welcome. You take care now. Bye-bye.